The use of blood-based eye drops as therapy for various ocular surface diseases has become increasingly popular in ophthalmic practices in recent years. In this episode of OCuTALK, Dr. Mahnia Madan will be discussing blood biologics and the benefits to patients suffering from all types of dry eye conditions. Dr. Madan?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us. Please welcome Dr. Mahnia Madan. Dr. Madan, thank you so much for joining us today.
Thank you. Thank you for having me on the show and inviting me to be here.
Well, absolutely. Thank you for taking the time out of your day to visit with us, Dr. Madan. Before we get the interview rolling, do you mind if maybe I ask if you could just let us know a little bit about your background and your specialty to our viewers?
Absolutely. So I practice in the beautiful city of Vancouver, BC in Canada. It's very nice out here today, super hot, finally. We don't get typically very hot summers, but it's beautiful today. I originally went to school down in Portland, Oregon, and then did a residency closer to where you are in Houston, Texas, and then practiced in Minnesota for a little bit and then moved back to Canada, back to Vancouver. I work in an ophthalmology tertiary type of practice, seeing a lot of course, dry eye patients and glaucoma patients that have dry eye. So really been a fascinating career, and I'm also a mom and I love traveling. So that's a little bit about me.
Well, excellent introduction, Dr. Madan. Again, thank you so much for joining us here in OCuTALK today. For our discussion today, we were kind of hoping you can discuss with us dry eye and the part that it plays with blood biologics and the treatment process. Before we talk a little bit about that, do you mind explaining to our viewers what blood biologics is?
Absolutely. I mean, that's a really fascinating area of, dry eye that we're now starting to see more and more of. In very simple terms, blood biologics is a part of area of regenerative medicine where we're using the patient's own blood to help heal a particular tissue. So in terms of eyes, it would be, of course, we're trying to heal the ocular surface with the patient's own blood. This sounds like a really new concept, but we've kind of known about the power of blood for a very long time. It actually dates back to Egyptian times, but it was not until 1975 that there was a paper published by Ralph and his colleagues. And in that paper, Ralph actually told his patients that if you suffer from dry eye, go ahead and just cut your finger, squeeze a little blood and put it in your eyes, and that's going to help heal. Blood biologics is just using the power of your own blood to help heal a tissue. Now, we also see the application of this not just in eyes, but all across medicine, right? If you've heard of something like a vampire facial within dermatology, that's doing microneedling on the skin and then using the patient's own blood to put on top of that skin. We use PRP, and that helps stimulate collagen. It helps stimulate, youthful appearance to the skin. And then we also see blood biologics used by our dental friends a lot. Periodontists use it in dental surgeries. They will use the patient's own blood to help heal the implants that they're putting in the gum tissue. And then we also see it in the use of orthopedics, where if a patient has an injury to their joint, many athletes have done this and they want to heal very quickly. They might get PRP injections right into their joints. So yeah, it's a little bit about blood biologics.
Well, that is amazing information, Dr. Madan. And so how do blood biologics work in the healing of dry eye, and how is our ocular surface impacted by that?
That's a really good question too. But before we kind of understand how blood biologics help heal the eye, let's talk a little bit about, our tear film, right? What is it about our eye that needs this blood biologics, or what are we trying to supplement, or what are we trying to heal? So when we talk about our tear film, our tear film actually contains over 1,800 different molecules. Okay, it's a very fascinating living, breathing tissue that has all these wonderful molecules that are not only working together to lubricate the eye, but they're working together to nourish the eye, protect the eye, heal the eye, and have anti-inflammatory properties from all the stress that we put on our eye, whether it's contact lens abuse, whether it's computer use, whether it's just our lifestyle. So our tear film contains all these amazing molecules to kind of help all of those processes so that our eye can do what it needs to do, which is to see this beautiful world, right? And so it's not something, another fascinating thing about our tear film is that it's considered epitheliotropic. Now, that's a really fancy word. But what epitheliotropic means is that it can support proliferation, migration, differentiation of corneal and conjunctival cells. And that's really cool, okay? And that's not something any over-the-counter lubricating drop can do because of all the stuff that our tear film can have. And now when we look at blood biologics, well, it turns out that our blood also contains all these fantastic agents, right? It contains growth factors, it can contain vitamins, it contains minerals, it contains proteins. And these are all these living agents that can help heal our ocular surface. And that's how they can be very, very helpful.
Well, again, that is amazing information, Dr. Madan. Thank you for that. And so what types of cases do you consider to be like a good fit for this? And like who would need this?
Yeah, so in my practice, I do find many patients can benefit from the use of PRP. And let's talk a little bit about, what PRP is, specifically what type of blood biologic we're using. So there's two really common ones. There's autologous serum, and then we also see the use of platelet-rich plasma, which is PRP. And now, if we remember from our biology class, our blood contains different cells. We've got red blood cells in our blood, which carry oxygen to our different organs. And then we have white blood cells in our which fight infections. And then we have these little tiny cells called platelets. And now these platelets are actually considered the powerhouses of healing. So they're the ones that contain all these wonderful growth factors and proteins and cytokines that rush to the site of tissue injury and help heal that surface. And so in autologous serum and in PRP, we're using the power of these platelets. We're isolating these platelets and then using them to help heal. And so in my practice, I would really find that a lot of my patients, whether they have mild dry eyes, moderate dry eyes, or severe dry eyes, can benefit from the use of these blood biologics. A huge benefit of these blood biologics is that they're completely natural, so they don't contain any preservatives, they don't contain any additives, and they don't have any stabilizers, that can harm the ocular surface.
Well, fantastic information. Dr. Madan, thank you for that biology lesson. It's been a while since I've been in biology class, so that definitely helped me out. But you were talking about blood biologics being natural. I wanted to ask you about how blood biologics compare to like over-the-counter products for dry eye. How does that? How do they compare with the standard dry eye product over the counter?
Look, I think in every dry eye, we need a drop, right? Our patients look to having a drop to help either heal their surface, lubricate their surface, or get relief from, all of their symptoms. So we know every dry eye patients need something to put on their ocular surface. Now, the big difference, again, is in over-the-counter lubricating drops and perhaps blood biologics, is that blood biologics go a whole step further, and they contain growth factors, and they contain vitamins, and they contain electrolytes, and they contain proteins that can help heal the ocular surface. Whereas over-the-counter drops, and not to knock on them, and I think we've come a long way with artificial tear drops as well. They can be preservative-free, and they do contain some, active ingredients that can temporarily help with the inflammation of the eye, that can also lubricate the eye and provide that comfort. But I don't think they target what a blood biologic can do, and they can really replace what our own tear film can do, because our tear film really is magical with those epitheliotropic properties, and that's what's really fascinating about it.
Oh, fantastic information, Dr. Madan. And so what's the process like for the patient? So when a patient comes in, how do they get these drops?
It's not a complicated process, because it's not like a medicine, right? It's within the patient's body to give. So they're usually, depending on, so when they're prescribed autologous serum or when they're prescribed PRP eye drops to use for their condition, they would typically go to a lab and have their blood drawn. And usually it's about 100 mils of blood. So it's not a lot of blood. Our body contains about 5 liters of it. So it's not a lot of blood that they're giving. And then usually the lab will work with a pharmacy, a compounding pharmacy, to process that and get, and centrifuge it to make it into autologous serum or PRP. We can also see some practices doing that in their own clinics as well. They can implement that with, the equipment and all these things and make some of these drops in their own clinic. But typically the process is, no longer than an hour for the patient, right? So they've got to get their blood draw, and then somebody's got to process that. And then they walk away with a supply of drops that they can use for at least the next 3 months.
Awesome. So you talk about the process of the patient goes through. How often do they need these drops? Is it something like, just whenever it's needed, or just do they have to come in every 3 months? How does that work?
Yeah, so a typical blood draw, so it's, like I mentioned, it's about 100 mils. Now that's going to give you drops that you can use for about 3 months. Okay, so that's about a 3-month supply. And also we know that blood biologics, because they don't have preservatives and additives in it, they don't last forever. They don't have a shelf life. You can't put it at Shoppers Drug Mart or at CVS Pharmacy for 2 years or 3 years. It doesn't work that way. So these biological tissues don't last that long. So their shelf life, is about 3 months to 6 months in the fridge or freezer. So a typical blood draw will give them about a 3-month supply that they should be using at least 4 times a day if they're in the initial kind of healing phases. And in maintenance, they can use it a little bit less, but usually we do want to use them frequently and use them up before they quote unquote go bad, right? When they're inactive and all these biological stuff is not active in it anymore.
Fantastic. So they would have to keep it refrigerated for about 6 months to about a year. Is this like a long-term type of thing? Like let's say after about a year of doing this, like, oh, okay, I'm good, or is it just something that a patient would constantly have to continue to use?
Yeah, that's a really great question. And patients often ask me this. They're like, oh, this really helps my eye, but am I going to have to do this forever? And as great as blood biologics are, they do come with their limitations. Not everybody loves being poked every 3 months, right, to get their blood drawn. And it's not always easy to keep your eye drops in the fridge all the time and, and running back and forth to your fridge to be able to use them. And we know compliance is an issue where, nobody wants to be using drops 4 or 5 times a day if they don't have to. And then the other barrier I find is that, insurances may not cover this. And so it can be quite expensive. So although a fantastic therapy, it has its limits. So I don't tell patients that they have to use this forever. Okay. The way I kind of tell them is, hey, we're going to do a lot to kind of lose the weight, right? Everybody understands weight loss. We're going to do a lot to lose the weight. And then we have to be on a plan to maintain the weight loss. And if we don't do anything, well, guess what happens to that weight?
Exactly. It comes back on.
It comes back on. So dry eye in that same way is not a curable condition. It's chronic. And so we're going to use these blood biologics to kind of reset your ocular surface, right? To heal what we can, to bring you some relief. And then we have to maintain it. And that could be maintained with other therapies. So I might turn to our immunomodulators, drugs, to help maintain that because they're a little bit more convenient, right? They don't have to be used as often. They don't have to be refrigerated. They can be covered by insurance. And so those are some of the reasons why I might switch to that. Now, some patients might come back and say, well, look, I'm really comfortable with using blood biologics because I love that they're natural and they're not drugs, and drugs have side effects and blood biologics really don't. And so I'm okay with it. And, I don't mind getting my blood draw. I love using something natural. And so they may say, hey, this really helps me. I find more relief here and I might continue to use this.
Fantastic, Dr. Madan. And you actually talked about it a little bit before. You said, there are always some side effects for certain things. But what about this? What would be the side effects, or are there any side effects for the blood biologics?
Not really. It's the patient's own blood, right? That they're really putting in their eye. And so I've been working with blood biologics for the last 4 years or so. And no, I don't really see any big, side effects at all. Most patients tolerate them very, very, very well. We don't get the stinging, burning that we can get with medications. We don't get, blurry vision or any of that. I think the only area where I find, maybe we don't, or they're not maybe as effective is when patients have a low platelet count. So that could be to severe aplastic anemia or, for other whatever medical reasons that they don't have good platelet count. like post-cancer treatments and things like that. So in those patients, I may not use blood biologics, but I don't really find that there's any side effects to it.
Fantastic. Excellent, Dr. Madan. And earlier we were talking about what a typical visit for one of your patients looks like. As far as your diagnostic process, what is that like when you see a patient come in with dry eye symptoms? So what does that visit typically look like?
I really find that my diagnostic process has changed so much over the last few years as our understanding of dry eye has increased, as our tools for treating dry eye have increased, right? So that process has really become much more patient-centered. Rather than me just collecting data. So we start with a very, very thorough kind of a questionnaire for the patient, where not only am I talking about their dry eye symptoms, but I want to talk about their lifestyle a little bit. I want to talk about how many hours are they on the computer. I want to talk about what their sleep is like, what their mental health is like, what their perhaps what they're eating, what their diet is like. And then we also get into makeup habits, right? What are patients' makeup habits? Are they eyelash extension users? Are they eyelash growth serum users? And how else are they using their eye? What else are they putting around their eyes? And then I talk about their skin as well in these questionnaires. And I talk about, is there rosacea? Are there concerns of, things that are going on in the skin? Because what we're finding is that everything is related, right? Our eyeballs are just not eyeballs on a stick. They are eyeballs in the whole body. And so we can't ignore all these extra stresses, these lifestyle things that add to the ocular surface disease without really addressing all of that. And I think this detailed questionnaire really, really helps them understand what are all these contributing things. And it helps me understand, how we're going to kind of tailor this treatment. And of course, we do a lot of diagnostic tests as well. We look at their oil glands, their meibography, their tear film staining, and all of that stuff. And then it's a really, lengthy consult with the patient to talk about the dry eye, because I really feel that when they understand what their condition is, then we can both be partners in treating it, right? Because a lot of dry eye still falls on them to do things at home, right? Whether it is, thinking about blinking more often, or reducing the computer use, or wearing sunglasses, or using their drops. So a lot of it is just still on them, right? And so if they can understand it, and I can understand what their limitations are, then we can come up with a plan that they're going to stick to, and that I'm going to be able to stick to and provide feedback on. So that's kind of what the dry eye process or the journey looks like when a patient comes in. And it's overwhelming. But when we start to look at all of this.
Well, that's definitely great information. I like how you always say it's kind of like a partnership, because it's great that we're diagnosing all this stuff and you're giving them the tools to do it, but then it's the compliance on the patients to actually do it. So that's pretty amazing. But thank you for saying that, Dr. Madan. And are those most of the cases that you see, like dry eye patients, and you were saying earlier, they come in with something wrong with their lashes, but obviously everything's all connected. Is it mostly dry eye patients, or what type of cases do you most often see?
Yeah, I most often in the last few years, definitely it's been 80% are dry eye patients on my schedule. They're either referred by another optometry colleague or another ophthalmology colleague. And then there's a lot of glaucoma patients that I also see, but not just for glaucoma management, but the management of dry eye in those glaucoma patients. Because what we're also finding is that when patients have glaucoma, they're going to get a side of dry eye. There was a talk that I recently did. Have glaucoma? Do you want a side of dry eye with that? Because those two conditions really kind of go together. The treatment of glaucoma today can also cause dry eye in a population. Dry eye is just so prevalent, and then we throw glaucoma on top of it. I think it can really exaggerate those conditions. So yeah, those are the type of patients that I see in my practice for sure.
Oh, absolutely, Dr. Madan. And as you said, like, just you're seeing dry eye more often, saying 80% of your patients. But do you have like an actual treatment protocol for patients who have or are presenting like mild to moderate dry eye?
Yeah, so I mean, we go through the same type of questionnaire, right? So we want to make sure we identify all the risk factors and what's causing their mild and moderate dry eye. And so usually for the mild dry eye, it is a little bit of possibly some lifestyle modifications that can help, right? So, I mean, a lot of times we don't want to just turn to medicine to fix things. I think our society, wants a quick fix, right? That's perhaps our mentality is going. When we talk about weight loss, nobody really wants to exercise and eat well.
Yeah, I hear you. Yeah, no one does.
Like, give me a pill. Can I just take a pill that will, make me lose all the weight and I don't have to exercise or do any of that hard work of eating well? But those are still the keys, right? Those are still the keys to long-term good health is managing all of those things. So in the mild dry eye, I really try to set the stage for, let's not try to dump stuff. You've got an amazing body. Let's honor how amazing our bodies are, and let's give our bodies a chance to do what they're doing by reducing some of these stressors, right? And burn out some of those fires. So mild dry eye may not, so we talk about some of those things. And as they start to go mild to moderate, I am pretty aggressive in dry eye treatment as well, because it is chronic, it's inflammatory, and that inflammation can cause damage to our whole apparatus, and then we can't produce good quality stuff, right? And so then I might, jump on with immunomodulators, and of course, all of our, in-office treatments like IPL or LipiFlow or, even blood biologics. I don't think we have to wait for things to get super bad. It's kind of like, you notice the patient has high blood pressure, don't wait until they have a heart attack to patient. We can intervene earlier. If they have a very mild blood pressure, you might say to them, hey, maybe, let's do some lifestyle stuff before I start dumping medications on you too. So there's kind of a fine balance, just mindful that our bodies are amazing and we need to treat them better. Yeah.
Well, it's bad news that I don't have a pill to make my weight loss and all my eye stuff get better. Dang it. Well, thank you for letting me know, Dr. Madan. Well, we talked about mild to moderate. What about patients who have like very severe dry eye? How different is that as opposed to the mild to moderate cases?
I mean, severe dry eye is stressful. It's stressful for the patient. It's stressful for the doctor too. I'm seeing these patients in clinic. I'm sympathetic, I'm empathetic, but I'm also in like this overdrive mode. Like, I got to fix this because it can scar, it can cause permanent damage, or, can really affect a patient's quality of life. And so it's definitely more of an overdrive where we're trying to now throw everything on that eye, right? Of course, the lifestyle modifications, and then, our drugs, and then blood biologics and in-office treatments. I'm often seeing some of my severe dry eye patients very, very often, sometimes on a weekly and every 2-week basis, especially if I put on a biological membrane on their eye, right? Or a bandaged contact lens on their eye. And, or some of the medications that we're using, because whether it's steroids, because you want to know how it's doing, of course, when we see it in the follow-up, but also to really kind of tell the patient to focus on this compliance thing, right? When I see them very often, it's constantly reminding them like, hey, you've still got to, I know this sucks, but you still got to, and we've got to see you on the other end of this. And then, patients especially with severe dry eye or moderately severe dry eye, get really discouraged. They're like, I'm not noticing anything. It's been 2 days or 3 days, or I think it's actually worse. And so there's a bit of that mental health in there. And again, I always go back to weight loss. If you kind of measure your weight, get on the scale every day, it's kind of disappointing. Because on most days it's actually up rather than down, right? Mm-hmm. So I said, no, that's not what we're here for. I'm not measuring your weight, and then get disappointed. So it's not the daily up and downs that we want to focus on. It's the long-term goal. Where are we going to be in 60 days? Where are we going to be in 90 days? If we stick to this, right? If we stick to our weight loss program, up and downs every day, let's not beat ourselves over for it. But where are we going to be in 60 and 90 days? And that's what really matters.
Well, I'm really loving the analogy of the weight loss thing, and it makes total sense to me. So it's opened my eyes to different ways of looking into it. But thank you, Dr. Madan. So what would be your long-term recommendation for patients as far as treatment options are concerned, like at home, like after you see them in office, like what would be your recommendations for at-home treatment?
Yeah, at-home treatments. I'm not I mean, of course, there are lifestyle modifications. They go a long way. If patients can reduce some computer use, if they can, religiously wear sunglasses, UV protection, and have a healthy diet, manage stress, and all those things, the hard things. Those are the really hard things to do. And then, of course, I want them to use your immunomodulators, right? If they're in the moderate to severe dry eye, so that has to be in there. I'm not a huge fan of just using lubricating drops every hour, every 2 hours, because we don't want to wash out our own tear film. Our own tear film is amazing. And so those should only be really used, for some symptom relief. And yes, they do have some healing properties, but being mindful of not just constantly using them. So my at-home therapy for them to be using lubricating drops maybe a couple of times a day, immunomodulators, and taking a good quality omega-3. And then, perhaps it's blood biologics that they might be on as well as maintenance. But that's really about it. I'm kind of finding myself going away from hot compresses as well. That's a question that comes up a lot. Hey, do you recommend hot compresses? And that's not something, I'm doing as active anymore because of how prevalent rosacea is and ocular rosacea is, and the inflammation around the eyelid. I forgot to mention, so lid hygiene is a huge part as well. So that's something that patients are, definitely told to do and maintain at home with as well.
Well, I'm actually glad you brought up eyelid hygiene, because I actually did want to ask you, like, how important is eyelid hygiene to this, and what role does it play in dry eye treatment, actually?
Yeah, eyelid hygiene is huge, right? We're kind of seeing an uprise of that in the last few years as well. So patients presenting with blepharitis, with styes, the amount of styes I think we now see in our clinic has really gone up, and and computer use, lack of blinking, lifestyle changes could really be contributing to all of this. So yeah, lid hygiene is so important, and our lids actually don't get the spotlight that they deserve in the apparatus of producing the tear film, right? Like, they are so important, and they work together to help produce these great quality oils that our tear film needs. And if we don't have that, we can really go into that vicious cycle of dry eye. So I think it's really important, and it's a huge piece. We can do things inside the eye, but if we don't manage the lid, it's again that weight loss thing. It's like being on a treadmill trying to lose weight, but eating a burger at the same time.
And not going to be good, definitely. Well, definitely. Again, a great analogy, and I love that we just come back to just keeping. You do the treatments, but we got to go back and we actually have to maintain our eyelid hygiene. So perfect. Thank you for that, Dr. Madan. And are there any new technologies or developments? I know we talked about a lot about blood biologics today, but are there any new technologies or developments that we should be on the lookout for?
Absolutely. I mean, I think what's going to be, I love the area of blood biologics because it's so natural, right? And it's honoring how amazing our bodies are. But I think I'm excited to see more research in this area and more comparative studies. So even in eye care, there's so many different types of blood biologics. There's PRP, there's autologous, there's amniotic membranes, there's also amniotic fluids. So it'll be nice to see some comparative data on what really works the best, right? And in one type of patient. So that's going to really help guide how we treat with blood biologics, because right now it is a bit of a wild west. We know they work, but but we don't know the nitty-gritties of it. So that's going to be really exciting. And you mentioned lid disease. I think we're going to see so much more in the lid disease area for blepharitis treatments. So right now, for blepharitis, for Demodex, we pretty much just have lid hygiene, right? Or we have oral medication like doxycycline, or we have IPL. But I think we're actually going to see a medication that helps kill Demodex, that can be topical, applied to the lid. So I think that's going to be really exciting. And I'm hoping we're going to see more technologies as well that we can employ within our clinics to help our dry eye patients as well.
Well, fantastic. We'll definitely be on the lookout for that, Dr. Madan. And before we leave today, was there anything else that you'd like to let our audience know about?
No, I think that's it. I think we really covered it all. I think it's just really understanding that dry eye is a chronic condition, and it's something we think about, just like losing weight.
Well,
Our
yeah.
minds.
Well, definitely. Dr. Madan, thank you so much. Everyone, that was Dr. Mahnia Madan. Dr. Madan, thank you so much for joining us today.
Thank you. Thank you.